What's up, everyone? Welcome back to the Daily Sean. For those of you who have never been here before, my name is Sean. I do a daily video on something related to nursing. No, there's no rhyme or reason. Probably won't change. Another fan question, another fan request. Someone messaged me today. Sorry you haven't noticed, I kind of am very spontaneous when it comes to these random thoughts and questions. So if you have a burning question you want to ask, a topic you're really passionate about, send me a message in some way, shape, or form. You can always reach me on Snapchat or on Facebook. Today's topic is a fan question asking how I got into critical care. And this one kind of excited me because for those of you that don't know me or are just hanging out with me, I have been a critical care nurse my entire nursing career except for 6 months of my life, which was the worst 6 months of my life, I must tell you. It was horrible. Pure torture. The irony, when I got into nursing school, I never thought in a million years I would be a critical care nurse. And quite honestly, I don't even think I knew what critical care was or that it even existed until I did my critical care rotation. I am not your traditional student, if you haven't figured that out. Nursing was, in fact, my third career. Yes, third career. Worked in retail while I was getting my degree in exercise and sports science, and I was an athletic trainer, certified athletic trainer for a decade before I even decided to go back and pursue my nursing degree. That's a whole nother story. As an athletic trainer, when I started nursing school, I thought that I was going to just go right into the med-surg / ortho type of environment. That was my background. It's what I knew. I was very knowledgeable in the rehab setting, injury prevention, orthopedic injuries, musculoskeletal injuries, so it was just a automatic assumed thing that I'm just going to become an ortho nurse. And then I did my med-surg rotation. Far be it from me to offend any of my med-surg nurses out there. Trust me, I only say these things because I could never do the job. I cannot do that job. So my hat's off to you for being able to do that job. I couldn't do it. Not in any way. Don't quite remember the sequence of events. Med-surg is always one of the first rotations you do because it's the catch-all. It's where you get to see the most diverse amount of experiences. Once again, my med-surg nurses, don't get offended by the term catch-all. On med-surg, medical surgical floor, you see almost all of the chronic and acute conditions and ailments that a nurse would come across, at least in the beginning. While I did that rotation, I was actually second guessing my decision to become a nurse. Moved on to, I think, my OB rotation. Actually had a very good time in OB, as well as the NICU, pediatrics. I probably could have done without the RSV and everything else. NICU, fetal heart tones, and OB, I actually enjoyed it. I enjoyed it so much that I was actually pretty good at it as a student. My then nursing instructor thought I could break the mold and become an OB nurse. Not that there aren't men out there who do the OB job. Not saying that. I'm simply referring to, in my area of the world, was to break the mold and be one of the first male nurses that worked in OB. That's all I'm saying. I actually know a handful of men who work in OB, have worked in OB, and are rock stars at it. Not even about to go over the stereotypes about that. Then I did my critical care rotation at the very end of whatever year that was. And it was like something went off in my brain as to, this is what I want to do. This is what I was meant to do. And it wasn't just the gadgets, even though the gadgets are really freaking cool. It wasn't just the gadgets. It was the immediate feedback that I could get from an intervention that I perform. While there's all kinds of other interventions in the world of nursing that you get immediate feedback, something as simple as giving Lasix, unless someone has a chronic kidney problem, 9 times out of 10 you're going to get an increase in urine output. In the ICU world, it was really cool to give a vasoactive drug and to see it happen in real time. Not to mention the cool gadgets. And back when I was in nursing school, we actually used the PA catheter, PA catheter quite a bit. They stayed in there a while, so I got to learn all kinds of cool things about CVP pressures, PA pressures, pulmonary artery systolic, diastolic, wedge pressures. I actually got to shoot wedge pressures. That was the coolest thing known to man. Then there were these things called arterial lines, central lines, and then there were people showing up with open chest. They had things in their groins. What really sold me was the amount of independence that the nurses were given. I'm trying not to offend my nursing colleagues who are not in critical care, but in the world of critical care, the critical care nurse is given quite a bit of autonomy. Not that other nursing disciplines don't. There just seems to be a bit more autonomy with nurses at the bedside in ICU. Maybe it's the population of patients. I don't have a complete answer for that. But I enjoyed that autonomy. And this is a big surprise to you, so hold on to your chairs here. I'm an adrenaline junkie. Anytime that there was an elevation in my heart rate, I was happy. Whether it was the codes or the intubation, multiple vasoactive drugs, being able to shock someone. I still remember the very first time I gave adenosine at the bedside as a student nurse. I think my heart stopped before their heart stopped. I'm almost positive my heart stopped because I was holding my breath. They tell you ahead of time, we're going to push this medication, and what it's going to do, it's going to go ahead and change that heart rate, and quite honestly, we're just going to go ahead and stop their heart. Excuse me? We're going to do what? And then when it was all over and it actually worked, it was the coolest thing in the world. I knew then I was in the right place. To solidify my decision, at the very end of the rotation, I had a patient who needed to be given a dose of low pressure. Not that the dose of low pressure is anything exciting, but in ICU, you give low pressure IV push. And I remember sitting at the bedside, giving my patient the IV push of low pressure, having a conversation with the patient, walking out of the room, my instructor pulling me aside and saying, you need to be in the ICU. You were in your element. You were completely comfortable. You looked like you were meant to be there. That was probably, the straw that broke the camel's back, the cherry on top of the pie. That was, I knew exactly what I wanted to do from there. I was so excited that I was just like every other nurse out there, that the minute I passed my boards, I volunteered for every shift known to man, realized early on that it doesn't matter what crap I go through, I still love the job. 11 years later, I'm still a critical care nurse. I'm now a critical care nurse practitioner, and it was one of the greatest decisions I ever made to move forward and advance my education. The excitement that I had as a student nurse watching those bedside nurses perform what they performed was the same excitement I had when I was the bedside nurse watching the NP intubate someone and put a central line in, do a bronchoscopy. That's the excitement I had when I watched that NP do that, and now I'm living that life. This is me paying it forward. Now I want to make sure that I pass on this passion and knowledge to those of you. It's worth it. It's so worth it. Even at the worst of my days, at the end of the day, I still get to do what I love. Whatever course you choose, does it click? Is there that click in the back of your mind? Is there that moment where you realize, I could do this for the remainder of my life because this is fun? And that's ultimately what it comes down to is, did it click? Is it fun? And can you honestly say that you would never view it as a responsibility, but as an opportunity? So those are the three things that you think about when you decide which direction you're going to go when you graduate. Doesn't seem like a lot of students have choices on clinical rotations right now because of the shortage we have when it comes to instructors and clinical sites, so you kind of get a grab bag of, you end up wherever they put you. You need to reach out for additional experiences. If you think that critical care is where you want to go, you need to get your foot in the door. You get a little taste of many disciplines in nursing when you're in nursing school, in the basic level nursing school. That's when you get to decide which one tasted the best. That was a really bad analogy. Bad analogy. What'd you think of this episode? Do you care to add anything? Are you in critical care? Wherever it is that you have landed, are you passionate about that choice? If you have any words of wisdom for these students out there, what would you tell them? What was it that helped you decide which direction to go? What helped direct your compass? Always love hearing from you. Leave me a comment down below. Your comments are my caffeine. Always appreciate a thumbs up. Share this with somebody. And as always, check your own pulse first.